So as far as how to prove a stressor, it really depends what the stressor is. For non-combat stressors, it's a little more difficult because you don't get that thing as to what happened. So a truck accident, in which case we're going to have to maybe find someone who saw it, or sometimes you can go through and find that the military has a record of the damage to the truck, even though they don't have a record of what happened to the people. You can look for it in different databases and things like that. Sometimes you need a lay statement from someone who witnessed the same thing that you witnessed, someone else who was there. They may not have PTSD, they may not have the same trauma that you have from that stressor, but if they were there or know about it, or maybe you told them about it, or they remember you leaving to go to that event. So it's sometimes about just doing some research and sometimes finding someone who can talk about what happened. There's other kinds of stressors though. There's things like hostile military actions. There's not really a record of the fact that you were afraid, that there were things exploding in the nearby area. You weren't a combat veteran. Maybe you worked on trucks, but you were scared because of the things that were going on around you. And those kind of things, VA has reduced the proof for, so that you can use things like a behavior change. If you went into service and you did 3 years and you were great and there was no problem, and then all of a sudden you get shipped out and you start having problems and you're drinking, or your behavior is not as good as it was, or your work product is not as good, or maybe you can just have a family member say they were fine and then they weren't fine. It's proof that something happened. So sometimes we kind of have to go around the way to find those sort of things. Generalized anxiety disorder. Anything can cause generalized anxiety disorder. It can be something that just started during service. Your nerves and anxiety became a problem at that point. And then for those kind of cases, you would need to show that it started during service and that it continued after.
Stepping into a C&P exam for mental health disorders, what are some recommendations you have for veterans?
Remember that you're supposed to be thinking about your worst days. Sometimes veterans go in and the examiner will say, "How are you doing?" "I'm fine, I'm great." And you forget that this is an evaluation. I think also to remember that you have to be forthcoming, because you have 1 hour, and it's not the same as when you go in for treatment and you have time to develop a rapport with that examiner, the person that you know, you've seen them multiple times, they know what's going on already, you can kind of feel more comfortable with them. With a C&P examiner, you see them once for maybe an hour. It's difficult to develop rapport, and so you don't want to tell them everything that's going on with you. I think that's a mistake for veterans. Sometimes they downplay what's going on with them because they don't want to come out and say how bad it is, particularly suicidal thoughts. That's so hard to talk about even with someone that knows you.
Yeah.
And so with a C&P exam, they don't want to talk about it. They also don't want to be hospitalized. They're scared to go in and tell someone that, and then, suddenly they're Baker acted. And that's not what veterans want. So I try to remind them, you have to talk about these things in order to get rated correctly, but you don't necessarily have to say, this is happening right now. You can say, I'm having suicidal thoughts weekly. Last week I was having, a few days ago I was having. You don't have to, they're not going to hospitalize you as long as you're not currently a danger to yourself. So you have to open up, and it's hard.
What is the importance of occupational and social impairment in the mental health rating criteria?
Every mental health rating has an occupational and social impairment aspect to it. 100% is total occupational impairment, total social impairment. So that's pretty severe. Every level below that is a different level of how impaired you are. That's how they rate it. If it's impairing you a little bit, but you're mostly fine, then you're going to get a lower rating than if it's an impairment in most areas of your life.
And now, is mental health, that's a secondary thing that you are aiming for, or is it more of a primary condition that you apply for?
So it can be either. If mental health is the primary condition, if it's caused by service, if it started during service, then that's the primary condition, and that's what you'd apply for. You can also apply for mental health as a secondary condition if you have a physical condition that's causing that mental health problem. If you have chronic pain, if you have tinnitus that keeps you up at night and you can't sleep, that can cause a lot of anxiety. There are service-connected conditions that cause mental health conditions. Parkinson's is a common example of that. So in that case, it's a secondary condition.
And now, if you have a primary condition that isn't mental health and a secondary condition that is mental health, can you eventually use those ratings to get TDIU?
Absolutely, yes. Any condition which prevents you from working warrants TDIU. Any condition that you're trying to get rated correctly, if it prevents you from working, then TDIU is on the table.
Does a veteran's medication regimen and side effects factor into the overall rating for a mental health condition?
It does. The lowest level of rating for mental health is 10%. And if your condition is completely controlled by your medication, I almost never see that. But if you're taking medication and it's controlling your condition, it's a 10% rating. If you have breakthrough symptoms after your medication, then they just rate it on the symptoms. So the medication is no longer a consideration at that point. As far as side effects are concerned, if you are taking medication and it causes side effects, those would be secondary service connection. So you would say you're taking medication and it causes erectile dysfunction, for instance. That's really, really common for mental health medications. Then you would apply for erectile dysfunction as a secondary condition to your medication from your primary condition.
Beyond a veteran's own testimony about their mental health condition, what other lay evidence could support a mental health claim?
Absolutely, evidence from people that live with you. That is actually sometimes more helpful than the statement from the veteran themselves, because the veteran edits themselves. We all do that. But the person who lives with you, your spouse, your children, they see things that you don't even know you're doing. You may not realize that some of your behavior is a problem, but they realize that that behavior is a problem. So a statement from your spouse, from your children, from coworkers, that's really, really valuable evidence.
And now when it comes to MST cases, how do you go about getting evidence for those?
Those, like with the hostile military action, those have a lowered standard of evidence because VA has recognized that people don't report those sort of things. So with military sexual trauma, a lot of times it's so underreported. So there's not going to be any record of that in your medical records. There's not going to be any record that things happened. So VA accepts other kinds of evidence to corroborate your story. They will accept, like we talked about earlier, behavior change statements. Family members can say they went in, they were fine. This was a cheerful, happy person. They came out a very different person with a lot of anxiety, a lot of fear. Those kind of statements, or maybe someone, again, they can tell that story. So you don't need an official record. You can corroborate it other ways, even sometimes by having a VA doctor corroborate what happened by saying, this is what they're saying. Everything is consistent with that. I believe that happened.
Okay, this one I think is important. What evidence can bridge a 10 or 20-year gap between service and a formal diagnosis?
So that's hard. It is hard to bridge that gap. If you have any kind of treatment records of mental health where you went in, that's obviously going to be the best evidence. But sometimes I'll find that substance abuse treatment, that's not necessarily saying that you were diagnosed with the PTSD or the anxiety disorder or the depression, whatever's actually going on, but that substance abuse treatment shows that something was happening. Also, family members, neighbors, people who knew you and knew there was a problem can maybe state that, okay, maybe you weren't getting treatment, maybe you weren't getting diagnosed, but you sure had some problems, and they can help you bridge that gap. It's difficult, though. With the gap in records, it can be difficult to get that service connection. PTSD is easier than other mental health disorders because VA knows that there can sometimes be a delayed reaction with PTSD. With the other diagnosis, it's harder. They want to see that continuous symptomology, so you kind of have to go to those other things like lay statements.